Welcome back to Face the Nation. Michael Dowling is the president and CEO of Northwell Health, the largest healthcare provider in New York State. He joins us this morning from Long Island. Thank you for joining us.
Thank you so much. Pleasure to be here.
I know in addition to your day job, Governor Cuomo had also asked you to help increase hospital capacity across the state. This morning, the defense secretary said that about 1,000 military medical professionals will be sent to New York today and tomorrow. Does that solve the problem? Is New York poised for this apex now?
Yes, I think we're as prepared as we can possibly be. Obviously, if another resource comes in from the federal government, that is great, as long as it is a resource that can help us. We have had a situation in New York where we've had federal assistance with the Comfort Ship on the west side of Manhattan and the Javits Center, and up to this point, they haven't been able to take that many patients because of the criteria that they use for admission to the facilities. So to the extent that they arrive here, to the extent that they can be helpful, obviously it's all great. We welcome all help, and we appreciate the offers. And if it all works, I think we will all be better off for it.
Is staffing the chief issue right now?
Well, staffing is always an issue because the severity of the issue, we've been in this now for a couple of weeks, and the intensive care staff, the physicians on the front lines, we have to use staff over and over. We have to put staff on overtime. We are getting staff in from around the United States. We're getting staff from upstate New York. So finding the capacity is one thing. You can create the beds. That's the easiest part, because you can create an ICU bed or a bed pretty much any place, and we have plenty of beds. The issue that becomes each and every day making sure that you have the right staff with the right skill levels to make sure that you can take care of the patients in the optimum way that you would want to take care of them. So, yes, staff is always an issue. But we're well prepared at the moment, and we will be well prepared no matter when that apex comes, whether it's this week or next week. We will be prepared.
There was a memo from Northwell, from your company, published by Politico, outlining guidance to medical staff, basically to help triage and decide who gets a ventilator and who gets to stay on one. Are we close to that point of having to make those hard decisions?
Yeah, we are not at that point at all. We have sufficient ventilators for the foreseeable future, and we're obviously getting more supply. And Governor Cuomo has been a major quarterback in that effort. The policy that you reference is a draft policy. It is something that we like to prepare for the inevitability in case that we ever have to do something in the future. You have to have a policy prepared well in advance. I don't think we will ever get to that point, but it would be foolish to wait until you have a disaster and then try to develop the policy during that situation. So this is all preparation. It's just a draft. It's not happening. We hope it never happens, but if it does, we are prepared.
Understood. If a patient has to go on a ventilator, what is the chance of survival? What are you seeing?
Well, what we're seeing, and I think it's across all areas, all facilities, that if you go on a ventilator, there is about a 20% chance that you will survive. We have had, obviously, patients survive off ventilators, but it's about a 20% chance. And as you know, people on ventilators a long period of time. But we've had successes. And the other thing I'd just like to mention here, because I think the public sometimes can get not always the right information. We've had lots of people discharged from the hospital successfully after they have been treated, many after they have been on a ventilator. So in our health system alone, about 300 people each and every day after successful treatment for the COVID virus actually go home. That is success. That's what we've got to also be talking about and thinking about and celebrating. That's the good news. And I think good news is what everybody needs right now.
What are you telling